Thank you, Susan. So I figured I wasn't going to use any slides since you're going to be over slide. It's going to be starting at 8:30. Didn't want to overwhelm you. And I figured I'd spend a few minutes talking about the foundation, who we are, and then how we've played a role to evaluate some of the things that you've heard today. So we're a statewide foundation. We were started with a Blue Cross Blue Shield conversion back in 2002. And our goal up until today has been to really impact the clinical setting and improve care. But with a focus on diabetes prevention, we knew that we needed to tackle this from a community and policy perspective. So beginning as of last year, we were thinking about looking for opportunities of where we can help evaluate some of the policy changes that were happening, not just in New York City, but elsewhere in New York State. But because our conversation today is focused on the city, I'll mention that we did support Brian, partially support Brian with RWJ and NIH to help evaluate the impact of the proposed soda ban. We participated in the salt reduction evaluation to see what the impact of those policies were on the outcomes of the expected study. And then we also looked at the WIC changes that were introduced back in 2008. New York State was one of the first states to introduce those changes before the feds, USDA, actually made it a requirement. We wanted to know whether or not it impacted consumer behavior on both the mother and the children, but also the family and the environment in which those changes took place. So were those locations where the WIC sites were, did they actually make the changes to make food, healthy foods available, and did it actually impact the consumer, the behavior consumer of the people living in those environments? So that gives you kind of a little bit of a flavor of what we have done. We also like to look at opportunities to help implement policy changes, both at the business level and at the community level, to help develop more advocacy for people to understand what these policies, what they mean for their lives, what they mean for their communities, and how they can benefit the whole. So for example, I think it was Brian who mentioned the Fresh Food Initiative. We worked with the Low Income Investment Fund to help businesses actually make those changes, to be able to apply for those loans, make the changes, and actually have a profit, because supermarkets they have a 1% profit margin, and it's not very appealing business. So how do we get businesses and communities to actually want to open up these supermarkets and implement the changes to actually get the loans that they need to actually open up? So moving forward, what we're looking to do, we really need to understand more as a foundation is how these policies coalesce together, right? So Brian mentioned, and both Andrew mentioned, the context of these policies in the ecological setting. From our perspective, we want to better understand, if you saturate all these policies in one community, what is the overall impact? We know from the Robert Wood Johnson Foundation that it's not one change that's going to create this curve in the obesity epidemic, but it's multiple changes happening at the same time in the same location, and dealing with some of the issues of poverty and other social determinants of health. So from our perspective, moving forward, we think we want to be able to, and I just mentioned this to Susan, but we'll be making this announcement in the next couple of months. The foundation is really looking to invest in communities and be able to bring in both advocacy, education, but figuring out how we can layer these policies in multiple sectors. So working with schools to be able to change the availability of healthy foods in those schools, working with multiple bodegas in the same community so that we can actually increase the number of healthy options in that location, that geographical setting. A lot of this is called place-based investments, community saturation, community change initiatives. But again, we don't think that one policy is actually going to solve this problem, that it's the coalescing of multiple policies and multiple interventions happening at the same time. I'm going to keep my comments short because I'd rather get to the questions and answer section, and be happy to answer anything that you'd like for me to cover. Thank you.